Well, the 2048 group is an amazing group of health policy experts, clinicians and practitioners who have come together over the last 2 years to pool their collective wisdom and come up with new ideas to help with the urgent task of reforming healthcare in the UK.
Patients should definitely be encouraged to take responsibility for their own care, where that's appropriate and where they're able to, I think.
I developed something called rheumatoid arthritis at the age of 3. And so I've been living with that as a chronic condition for nearly 60 years now. When I was at university in 1973, I learned something called transcendental meditation. Really, just the theory was to help me cope with the stress of my finals. But I found that began a whole process of me beginning to sort of self-manage my own condition. And using that meditation as a basis, I was then able to analyze for myself what foods suited me, what activities were good for me, what activities were bad for me. And I became effectively self-manager of my condition.
So actually we are empowering patients more to own their condition a bit and giving them the tools to help them manage their condition when they're unwell without always having to resort to seeking medical help.
Ideally, if we give patients better access to technology and better access to information, we can empower people to look after themselves better early in disease pathways, in a kind of more preventative manner, so the kind of burden on patients of complicated long-term conditions become less. But we're, I think, behind other industries in working with users of our service, both to design the service, but also to allow them to look after themselves. We do the job of bank clerks now and are happy about it. We should be doing the jobs of some of the kind of frontline staff in the health service and, saving time and becoming better informed about our healthcare, so getting better outcomes and a better experience.
I think that involving patients in their own care involves, first of all, having a better narrative with patients. We know from research that clarity is reassuring. And when patients have a clearer understanding about what they can expect, medicine's not necessarily a precise science in many aspects, but giving people a clearer understanding about what they can expect, what the outcomes are, really helps people to understand the patient journey. I also think better quality literature, information, better quality websites that people can see and understand more about their conditions. But the key thing is to get the narrative better with the individual.
At the moment it's a sort of fast care service rather than, i.e. fast food, not very nutritious, and tending to rush from one patient to another rather than sitting down with patients with serious problems and saying, right, we're going to help you develop a program which really you can do something about and which will help you in the next a few years.
I had a number of agreements and disagreements with doctors over the years, but I think one very good example is that when I'd gone to university, my rheumatologist had said to me, "You're, quotes, an intelligent young man. I give you the freedom to vary your medication as you seems appropriate for you." But after I'd been meditating for 2 or 3 years, I realized I was getting much better and I could probably remove my medication altogether, which I did very, very carefully, talking to another doctor that I knew about it. And I came completely off my medication. And I very proudly went back to my rheumatologist and told him, and he was furious. And he said, "I never gave you permission to stop taking your medicines."
I think the patient's role in the NHS has changed tremendously. When the NHS came into existence in 1948, the NHS was very doctor-centric, and it was organised around the needs of doctors, around the needs of organisations, to deliver what was best for them. Quite rightly, over the last 60-odd years, the role of the patient has been much more empowered. It's much more now based upon a more mutual relationship about sharing, understanding, to make sure that the patient's perspective is brought through.
When I was a medical student, there was quite serious debates about whether you should even tell people their diagnoses, and we were incredibly paternalistic about the way we approached care. That's been transformed in a way that's different and enormously positive, but does mean that kind of interaction with people, the kind of one-to-one interaction between healthcare professional and patient, the kind of balance has changed.
Generally speaking, I think we've got a younger group of patients coming through, say under 50, under 55, who are far more comfortable with a more partnership arrangement with their caring agency, with their doctor, their nurse. They want to have a genuine partnership. They want to know what's going on. They want to know what their options are, what the choices are, and they want to be very much in control of what's going on. But here's the other thing. Another interesting dynamic as we move to a more patient-involved NHS is we're looking at patients as complete people who have educational needs, who have a job to go to, who have leisure interests, who want to learn to play the guitar, who want to do a yoga class. We have to factor these sorts of things into living with their disease and in terms of what they want to do alongside their disease.
I think other things that we can do to make patients more involved are give them access to their records. So again, there's a lot of fragmentation over recent years in the system. So patients may have one health record that's held at hospital, another one that's held at their GP, another one that's held at the out-of-hours service. And if they move to another area, the hospital record doesn't follow them. So there's a lot of patients having to explain themselves to multiple health professionals again and again. And actually in this day and age, that's completely unnecessary.
My health record should be my property. I should own them, I should understand them, I should give permission for other people to consult them as and when necessary, rather than being deprived of having that knowledge and that ability.
Some healthcare professionals are still in a kind of paternalistic world where they talk about a GP record. It's not a GP record, it's a patient's record. And there shouldn't be any debate about whether GPs hand over their records to patients. The debate should be whether patients hand over their records to us.
What we're really aiming for in the patient-doctor relationship is a sort of shared decision-making process. And there are specific tools which have been developed which facilitate that process towards shared decision-making. Those are not used very widely, and they could be used much more widely. So that would help, again, make the doctor aware that it's their responsibility, or any health professional, that it's their responsibility to encourage the patient to participate in the process. And also the patient would be given permission, as it were, to ask questions, to interact, to do research independently. And that leads to a much better relationship between doctor and patient, definitely.